I need to tell you something that has been on my mind for years, and I know that once I say it openly, some of my colleagues may not agree with me. But after more than 20 years in medicine, and after seeing what happens to people who follow every recommendation without question, I can no longer stay silent. I'm Dr. Michael Kent, and here is a reality many avoid discussing. Sometimes, the worst thing you can do for your health is undergo too many tests, especially after the age of 60 or 65. Now I can already hear some of you thinking, wait a second, isn't a doctor supposed to encourage regular checkups? Isn't prevention the main goal? And yes, that is exactly what we have all been taught. Detect issues early, identify problems before they grow, stay on top of your health. That message is everywhere. But what if I told you that this message is missing the most critical part? The part that explains what happens after something is found. Because what often goes unmentioned in health screening promotions is this: once something is detected, anything at all, even a harmless finding, the process begins. And sometimes that process can negatively affect your quality of life. So today, I will walk you through 4 medical tests that, in my experience, create more issues than they resolve, particularly for individuals over 60. I am not sharing this to discourage medical care. I am sharing it so you clearly understand what you are agreeing to before accepting every test offered. Before we move into the specific tests, there is an important concept you need to understand, one that changed how I approach medicine. It is called the cascade effect. Once you recognize it, it becomes impossible to ignore. Here is how it works. You go in for a screening test, even when you feel completely fine. You're going about your life, handling your routine. Then a test result comes back showing something. Maybe it's a spot. Maybe it's a shadow. Maybe it's just a number slightly outside the normal range. That finding could be completely harmless. It may have been there for 20 years and could stay there for 20 more without ever causing any issue. But here's where the problem begins. The doctor notices it and now feels the need to act. Because what if they ignore it and it turns out to be serious? So you're referred to a specialist. The specialist orders another test, one that is more detailed. That test may show the same finding still unclear. Now the discussion moves to a biopsy, a procedure, or even surgery. Each of these steps carries risks, such as infection, bleeding, complications, stress, and lost time. And here's the key point. By the end of this process, in most cases, you learn it was nothing. It was never going to harm you. Yet you've spent months worrying. You've undergone procedures. You may even have faced complications, leaving you worse than before. All of this started from a test you took when you felt perfectly fine. That is the cascade, and it begins with a single test that might not have been necessary. So let's focus on the first test that repeatedly leads to this situation. It's a tricky one because it sounds intelligent, modern, and preventive. I'm referring to whole body scans, full body MRIs, or CT scans that claim to check everything at once. You've likely seen the advertisements. Come in, get scanned from head to toe, and catch problems early. It sounds impressive, doesn't it? Like getting a full picture of your internal health. And the appeal is understandable. The idea of knowing everything and having control is very attractive. But here's what typically happens. Imagine you're 65 years old and feeling well. You're active and have no symptoms. You decide to get one of these scans just to be cautious. You go in, lie still in the machine for about 30 minutes, and a few days later, you receive your results. In the report, the radiologist notes something, a small nodule in your lung, about 3 millimeters, roughly the size of a pencil eraser, or maybe a cyst in your kidney or a spot on your liver. The report suggests follow-up imaging in 3 to 6 months. Now, consider how that feels. You entered feeling healthy, and now you're told there's something in your body that needs monitoring. It becomes difficult to ignore. Every deep breath makes you think about that lung nodule. Any sensation in your side reminds you of the kidney cyst. So, 3 months later, You return for another scan. Maybe the finding is still there. Maybe it appears slightly larger, uncertain. The radiologist then advises seeing a specialist. The specialist, aiming to be careful, recommends a biopsy, and a biopsy is not minor. It involves anesthesia. It requires inserting a needle into your lung, kidney, or wherever the issue is located. It carries risks of infection and bleeding. And importantly, research shows that when healthy individuals over 60 are scanned, nearly all of them have some kind of abnormal finding. This is not an exaggeration. We're talking about roughly 90 to 95% of people, small spots, minor cysts, faint shadows. In medical language, these are called incidental findings, things discovered by chance, and the vast majority of them, truly the vast majority, will never lead to any issue. They are simply part of having a body that has aged over 6 or 7 decades. You can think of them as internal wrinkles. However, once they are identified, they are hard to ignore. That is when the chain reaction begins. There is actual research on this. Studies followed individuals who underwent full-body scans. And what did they find? Those who had the scans did not live longer than those who did not. They did not prevent diseases either, but they did experience much higher levels of anxiety, depression, and unnecessary medical procedures. The scans did not improve their health, they made them feel worse. So what is the better approach? This matters because the message is not to ignore your health. The message is to focus on what truly matters. Instead of relying on images of your internal organs, pay attention to how your body functions. Can you climb 2 flights of stairs without losing your breath? Can you stand up from a chair without using your hands? How is your balance? How well do you sleep? These functional indicators provide far more insight into your health than any scan can. If you want a meaningful health evaluation, sit with a doctor who takes the time to understand you, someone who reviews every medication you are taking, because it is very likely that at least one may be causing more harm than benefit. You need someone who discusses your diet, your physical activity, and your social life. These everyday factors, even if they seem routine, are what truly shape your overall health. A scan searches for problems that may not even exist. A functional assessment improves the health you already have. That is a major difference. Now let's move to the second test. This one affects many people because it connects to a common fear as we age. We are talking about getting a brain MRI for minor memory concerns. Consider this situation. You are in your mid-70s and notice that sometimes you forget the name of an actor you like, or you walk into a room and cannot recall why you went there. These are normal experiences. They happen to almost everyone with age. But perhaps your children become concerned. They may have heard about Alzheimer's disease and feel worried, so they encourage you to get a brain scan just to be sure. That fear is understandable. It is real. No one wants to think about losing memory or sense of self, but here is what you need to understand. Getting a brain MRI for mild forgetfulness is rarely useful. In many cases, it can actually be harmful. Here is why. You undergo the MRI, and a few days later you sit with your doctor reviewing the results. The report may include terms like mild cerebral atrophy, age-related changes, white matter lesions, or small vessel disease. These terms sound serious. They may suggest that your brain is declining, but the reality is very different. Those results are entirely typical for someone in their 70s. They're simply describing what most brains look like at that stage of life. It's similar to scanning your skin and being surprised to see wrinkles and age spots. Naturally, you will, because that's how skin appears at 75. The issue is that medical terminology doesn't sound normal. It sounds like illness. And suddenly, you start thinking you have brain damage, or that Alzheimer's is just around the corner, even when you're actually fine. Here's the frustrating part. Research shows that when brain scans are done on healthy individuals over 75, more than 90% show findings that appear abnormal in reports. More than 90%. Yet most of these individuals have completely normal memory and thinking abilities. The images don't reflect reality. I've seen people who are mentally sharp, reading regularly, handling their finances, solving puzzles, and their MRI results look concerning. At the same time, I've seen individuals with early dementia whose MRI scans appear fairly normal. The image doesn't always tell us what we assume it does. So, what should you do instead? If you're concerned about memory, there's a far better way to evaluate it. We can perform simple tests right in the office, and these tests take about 10 minutes. We might ask you to remember 3 words, draw a clock, or count backward from 100 in steps of 7. These are straightforward tasks that actually measure how your brain functions, not just how it appears. If those tests reveal an issue, then we begin looking for causes. And here's something important. Most memory problems in older adults are reversible. It could be a medication causing mental fog. It could be low vitamin B12 levels. It could be depression, which often presents as memory issues in older adults. It might be sleep apnea reducing oxygen to the brain during the night, or even a thyroid imbalance. We check all of these first, and you'd be surprised how often correcting one of them restores memory. No MRI required. The focus is on function, not images. We treat the individual, not the scan. Now, if someone is steadily getting worse, getting lost in familiar places, or unable to manage finances, that's a different situation. In such cases, a full evaluation, including imaging, is necessary. But for everyday forgetfulness linked to aging, an MRI often creates more confusion than clarity. All right, moving to the third test on my list. This one often surprises people because it seems logical at first. I'm referring to heart stress tests, specifically placing someone on a treadmill just because they've reached a certain age. Here's a common scenario. You might be 72 and preparing for a routine surgery. Nothing major, perhaps a hernia repair or knee replacement. Hospital protocol states that everyone over 70 must undergo a cardiac stress test before surgery. So even if you feel fine, even if you can walk a couple of miles without chest pain or shortness of breath, you're still asked to take the test. Now consider this. If you can walk 2 miles in your daily routine without difficulty, what new information will a treadmill test provide? Your everyday activity already acts as your stress test, and you're passing it regularly. But procedures are procedures, so you go on the treadmill, and this is where complications begin. Stress tests have a high rate of false positives in older adults. This means the test may indicate a problem when none actually exists. It could be due to a slower heart rate response with age. It could be influenced by medications. There are many possible reasons that have nothing to do with a serious blockage. However, once the result appears abnormal, the process escalates. You're then scheduled for a cardiac catheterization. That's the procedure where a tube is guided through an artery up to the heart to examine the blood vessels. It is invasive. It carries risks. And quite often doctors find what you would expect in a 72-year-old heart, some plaque, some narrowing, but nothing requiring stents or surgery, nothing that was about to trigger a heart attack. Yet you have undergone an invasive process, and more importantly, you are now labeled as a heart patient. New medications are added, and the psychological impact begins. Maybe you were active before, playing tennis or staying physically engaged, but now you hesitate to push yourself. The test that was meant to protect you has reduced your confidence and limited your daily activities. So what is the alternative? Pay attention to your body. That is the most reliable stress test available. If you can climb stairs, walk at a steady pace, and carry out your normal routine without chest pain or unusual shortness of breath, it indicates your heart is functioning well. These are the signals that matter: chest discomfort during effort, unexpected breathlessness, or dizziness. If those symptoms appear, then yes, getting evaluated is important. That is when a stress test becomes appropriate. But if your goal is to understand future risk, there is a better option. It is called a coronary calcium score. This is a quick CT scan. It takes about 5 minutes. No treadmill, no needles, minimal radiation exposure. It measures the amount of calcium, essentially hardened cholesterol, in your arteries. The result is a simple number. A score of 0 means very low risk of a heart attack in the coming years. A higher score suggests the need to focus on prevention, diet, exercise, and possibly medication. The key difference is this: the calcium score helps assess risk and guide prevention. It does not automatically lead to invasive procedures. It provides information that supports decision-making rather than creating anxiety that pushes you toward unnecessary interventions. Do not agree to a treadmill test simply because of age. Trust what your body consistently shows you. Now we move to the fourth test, and this one may be debated. This is about colonoscopies after age 75, specifically routine screenings when previous results were normal and no special risk factors exist. To be clear, this is not against colonoscopies. They are highly effective. They are recommended starting at age 45 or 50 because they help prevent colon cancer by removing polyps before they become dangerous. If you are in your 50s, 60s, or early 70s and due for one, it is important to complete it. However, every medical test involves weighing benefit against risk, and that balance shifts with age. The benefit of a colonoscopy is preventing a cancer that typically takes 5 to 10 years to cause issues. But at age 78 or 80, does that benefit still outweigh the risks? Because there are risks, and they increase over time. The preparation involves drinking a solution that can lead to dehydration and weakness. The sedation carries a higher chance of confusion or breathing complications in older adults. And the most serious concern is perforation, a tear in the colon wall. As we age, the colon wall becomes thinner. The risk of tearing during the procedure increases, roughly doubling or tripling after age 75. A perforation is a medical emergency. It often requires urgent surgery and may result in a colostomy bag. For an 80-year-old, this can significantly affect independence and quality of life. Now compare that with the benefit. You are trying to prevent a condition that may take years to develop. If life expectancy is under 10 years, the benefit becomes limited. The risk of harm from the procedure may exceed the potential gain. That is why most medical guidelines recommend stopping routine screening between ages 75 and 85. This is not a fixed rule. If there is a family history of colon cancer, previous polyps, or conditions like inflammatory bowel disease, the decision changes. But for the average individual without added risk, continuing colonoscopies every 5 to 10 years into the 80s may do more harm than good. So, what is the better approach? Do not ignore colon health. Instead, shift to careful monitoring. First, watch for symptoms. This is essential. Persistent changes in bowel habits, blood in stool, unexplained abdominal pain, weight loss, or anemia are warning signs. In those cases, age does not matter. A colonoscopy becomes necessary to find the cause. Second, focus on diet. This is highly effective. Increasing fiber intake is one of the best steps for colon health. Fruits, vegetables, beans, and whole grains support beneficial gut bacteria. These bacteria produce compounds that reduce inflammation and lower cancer risk. Adding foods like lentils, broccoli, oatmeal, and apples supports overall health without risk. The takeaway is simple: complete colonoscopies when appropriate through your early 70s. After that, for most people, focus on symptom awareness and proper nutrition. So, in summary, these are 4 tests that can sometimes cause more harm than benefit, especially after age 60. Whole body scans that detect non-issues. Brain MRIs for normal forgetfulness that increase anxiety. routine stress tests that lead to unnecessary procedures, and colonoscopies after 75 that may carry more risk than value. There is a clear pattern. It is the cascade effect. One test leads to another, then a procedure, then a complication. And along the way, an important question is often overlooked. Is the patient actually better off? After more than 2 decades in medicine, one thing stands out. Health is not defined by perfect test results. It is defined by function. It is about being able to live your life, spending time with family, staying active, enjoying simple routines without fear or unnecessary medical intervention. The goal at 65, 70, or 80 is not only longevity, it is quality of life, independence, dignity, and comfort. Sometimes protecting that means declining a test that leads to unnecessary complexity. This does not mean avoiding medical care. It means being informed. Ask questions. When a test is suggested, understand the reason. Ask what happens if something is found. Ask about the risks. Ask if there are alternatives. Then decide based on what matters most to you. You are responsible for your health decisions, not guidelines, not automated reminders, not standard protocols. The more informed you are, the better your choices will be. If this information was useful, consider sharing it with someone who may benefit. And if you want more clear discussions on health and medicine, subscribe to the channel. These conversations are important and will continue. Share your thoughts in the comments. Have you ever felt pressured into a medical test that did not seem right? Every comment is read, and your experiences help shape these discussions. Thank you for watching. Take care of yourself.